This is every mental disorder and its effects explained. Imagine your brain suddenly failing to tell the difference between a dream and reality. That's schizophrenia, a chronic condition where perception, emotion, and behavior get completely scrambled. You might hear voices actively insulting you, and to your brain, they sound entirely real. Delusions also creep in, making you falsely think ordinary events hold secret, hidden messages meant just for you. The management trick isn't a quick fix, but a lifelong routine of structured care and strong support systems to keep those vivid hallucinations in check. When a child faces unbearable trauma before the age of 7, their brain pulls an extreme survival hack. Unable to process the horror, it splits consciousness into several identities or alters. This is dissociative identity disorder. These alters have their own specific memories, ages, and coping behaviors. Sometimes one takes over while another blanks out, causing frightening periods of missing time. The therapeutic approach here isn't to erase these identities, but to gently integrate the traumatic memories and reduce that intense, disruptive disassociation. Picture someone who constantly breaks rules, manipulates others, and feels absolutely zero guilt. Antisocial personality disorder isn't about being highly emotional. It's a fundamental lack of empathy and moral accountability. They might lie or act aggressively just for power or a cheap thrill. If they hurt someone, they will probably just minimize it or blame the victim. Because their brain processes emotional consequences differently, the ultimate management tactic is tricky. They rarely think they need help, making the condition very resistant to standard treatment. Imagine living with the exhausting ingrained belief that everybody's out to get you. In paranoid personality disorder, people see hidden threats in totally everyday actions. A friendly greeting might be instantly seen as an insult or a clever manipulation tactic. They guard their secrets fiercely, terrified that close family will use the information against them. Unlike psychosis, they aren't actively hallucinating, but their beliefs are incredibly stubborn. The treatment trick requires immense patience, as this deep mistrust usually extends right to their own medical therapist. Delusional disorder is a fascinating condition where someone holds on to one fixed false belief for at least a month, despite obvious proof that it's wrong. With this disorder, the person might act completely normal in other aspects of life. The delusions are usually things that could realistically happen, like being secretly loved from afar or constantly followed. They twist evidence to beautifully fit their story, easily dismissing anything contradictory. Dealing with this involves carefully navigating their defensive resistance, as directly challenging the delusion rarely works. Catatonia is a bizarre, severe syndrome that completely hijacks physical movement. It usually tags along with other illnesses like major depression or bipolar disorder. A person might quietly freeze in an unnatural pose for hours, completely mute, ignoring all verbal instructions. On the flip side, they might experience excited catatonia, pacing around wildly without any clear purpose. They might even mindlessly echo your words. The medical hack here is a swift intervention. When properly identified, it actually responds surprisingly fast to specific targeted medications. Bipolar disorder is an intense emotional roller coaster, but when it includes psychotic features, the ride gets wildly unpredictable. It strictly requires at least one manic episode, a prolonged time of wildly high energy and impulsive choices. During mania, a person might genuinely believe they have immense power or intelligence. When severe depression hits, they might conversely suffer delusions of intense guilt. The key difference from schizophrenia is that these psychotic features only happen during mood swings, completely fading once their mood is finally stabilized with proper treatment. Cotard syndrome is as phenomenally rare as it is terrifying. Imagine your brain completely failing to connect internal emotions to your physical body. Because of this strange emotional flatline, the person genuinely believes they are completely dead, missing their internal organs, or have permanently lost their soul. Even if you show them logical evidence, they'll deny it, sometimes boldly claiming that they're immortal. To overcome this highly dangerous condition, doctors must treat the underlying severe depression to effectively reconnect the brain's broken emotional pathways. You look at your own mother, but your brain insists that she's an identical imposter. That is the heartbreaking reality of Capgras syndrome. The visual recognition center in the brain works perfectly, but the emotional connection center simply goes dark. To cleverly solve this mismatch, the brain invents a delusion. She must be a fake. This bizarre phenomenon can even happen with family pets. Managing it is incredibly tough and focuses heavily on reducing distress and actively treating the underlying neurological or psychological disease. Living with borderline personality disorder is like walking around with emotional burns. Absolutely everything hurts intensely. It's driven by the brain's fundamental inability to regulate feelings, leading to an absolutely terrifying fear of abandonment. Relationships are a dizzying swing between viewing someone as a perfect savior one minute and a cruel enemy the next. People often struggle with personal identity and resort to risky behavior to escape pain. The successful management trick involves long-term therapy focused on emotional regulation and strict distress tolerance. Standard PTSD comes from a single terrible event, but complex PTSD builds up from prolonged inescapable trauma like chronic abuse or neglect. The exhausted nervous system gets stuck in a permanent threat detection mode. The person carries a crushing weight of toxic shame, genuinely believing the trauma was their own fault. Trusting absolutely anyone feels impossibly dangerous, and emotional flashbacks can wash over them in sudden waves. Healing requires a slow, deliberate process of stabilizing the nervous system and carefully rebuilding a sense of emotional safety. Obsessive-compulsive disorder isn't about simply being tidy. It's an exhausting trap of unwanted, terrifying thoughts called obsessions. You might horribly obsess over accidentally harming someone or committing an immoral act. To briefly escape this anxiety, the brain forces you to perform compulsions, like checking locks 50 times or endlessly washing your hands. The person logically knows it makes no sense, but they can't stop. The therapeutic trick here is interrupting that cycle directly, using structured interventions to teach the brain that it can survive anxiety without the physical ritual. Let's look at a condition that blends two major psychological challenges together seamlessly. If schizophrenia and a severe mood disorder magically combined forces, it would be schizoaffective disorder. You experience deep depressions or wild manic highs, but with a major twist. Psychotic symptoms like hearing voices stubbornly stick around even when the mood episodes disappear. This heavy overlap makes it a very tricky puzzle to solve clinically. Managing this double impact disorder requires a clever combination of antipsychotic medications, mood stabilizers, and solid social support to keep the person grounded and actively prevent a severe, damaging relapse. Imagine experiencing a horrible trauma, and the days immediately following, your brain essentially shorts out. Acute stress disorder hits between 3 days and 1 month after facing a severe, realistic threat. It's the brain failing to adapt to the stress, leading to intense flashbacks, nightmares, and a bizarre feeling of being totally detached from reality. The key intervention trick here is providing immediate structured psychological support to help the brain correctly process the shock before it permanently turns into long-term post-traumatic stress disorder. Anorexia nervosa is far more than a simple, superficial desire to be thin. It's a severe distortion of reality. The brain incorrectly equates starvation with safety and control, making the fear of weight gain absolutely terrifying. Even when the body is visibly failing and the heart rhythm is dangerously slowing, the brain insists that more restriction is needed. It's a serious malfunction in the brain's internal reward systems. The life-saving hack requires both immediate medical stabilization and intense psychological rewiring to correct these stubborn, deadly cognitive distortions. Our brains are wild survival machines, but sometimes their coping hacks severely backfire.